Good morning, good morning. This is the thing about Boston. Like, it was so hot yesterday. It's raining today. Who knows? Maybe it will snow tomorrow. I told my husband, we should move down south, honey, where I can plant a mango tree. He's like, no. You're coming to work with me. It is Friday today. It is my short day, my happy day, my favorite day of the week. We made it to the second home. Let me give you guys a little room tour. I'm gonna turn on my x-ray machine for sonic instrument. Beautiful chair. This is my favorite part. The saddle chair. Okay, my tray. We have pillows, covers, gloves, mask. So I rearranged some of these drawers, but this is how it looks here. This is my favorite, you guys. If you want to keep your drawers nice and organized, head over to Marshall's, TJ Maxx. I actually picked these up at Home Goods, but I have seen them in all of those stores. So this here is the laboratory where we have our toothbrushes and some lab stuff. The other hygienist room, another operatory, another op, and another operatory for the dentist. So pretty much I am all the way right close to the front desk, which I love. I hear some happy noise. Before I even get started, coffee first. I put some coffee mate creamer. See how we have some here. And about 10 ounces of coffee. And I'm having a banana. I stopped by the corner store that we have around here. My patient should be arriving any second. So as soon as she gets here, I'm ready to roll. So it's a busy day. But I made it like that because I'm crazy. Everything goes face down as the vapors of the autoclave go up. That way they don't stay like wet. Time to load this bad boy. We are done for today. Finish early, so instead of seeing 6 patients today, we saw 5 patients. So this always happens. This is why I am productive and I overbook myself. Not overbook myself, but like I give myself 45 minutes if they already had an exam and x-rays in the past and I'm only doing a perio maintenance. Especially patients that I know their hygiene has been really good. I only do 40 minutes, 45 minutes. It's just enough to do the cleaning. So now I'm leaving the room ready for the next hygienist. I'm off until Wednesday, and so far my first patient canceled. Let me show you my schedule real quick. So far I have 2 openings, and I'm gonna try to work on that. I have until 1 o'clock that I work, so that gives me plenty of time to be productive and do that. So I'm gonna be doing some recall. This is why I have 2 pair of loops, because I'm spoiled like that, okay? Like, I don't like to be carrying my loops around. I leave them to charge here. So now that I'm done, I'm just gonna be doing some recalls, heating up some coffee, finishing up my banana, and I need to do what's in my bag video, because like I said, I'm obsessed with this bag. This is my second cup of coffee, and I say cup of coffee, but you know, it is like 12 ounces of coffee. That is not a cup, honey. Today I am working without a dentist. In Massachusetts, we are able to practice this way. Like, the only thing I'm not allowed to do is give local anesthesia if there's no dentist in the building, so we're not gonna do that. It was a pretty productive schedule. I'm very pleased, and my day is going by so fast. I literally have an hour until I get home. But yeah, I'm gonna be doing some notes right now, because priority for me is to stay on schedule. Sometimes that means that the note will have to wait until I have like a moment, which is now, because everybody was coming literally back to back, so it was pretty busy. I'll show you the template that I have. Medical history, review with patient, no changes, no contraindications. Personal, that's where I get to add a little bit of, you know, like my patient, if she's traveling or if she got a cat, little like special notes I try to write there so that I can remember and ask, you know, hey, how was the trip? Next, I have chief complaint, and that's very important. Like, if they said, oh, I have sensitivity, how do we address the chief complaint? Did I recommend Sensodyne? Did I say, oh, I think it's the gums, you need to floss better, you need a localized scaling? Like, how do we address the chief complaint, and what was it? It's so important to have it documented. Radiographs, did we take any? What did we take? And were they examined by the dentist? Exam, periodic, comprehensive, perio exam, established comprehensive exam, limited exam, you know, like what type of exam was it? Any mobility? I always check for mobility. What was the periodontal diagnosis? Generalized, active, chronic periodontitis, was it just gingivitis, things like that. What were the recommendations that I gave my patients? Oral-B electric toothbrush, flossing daily, water pick, interproximal brush. What was the recommendation? That way we can actually ask the patient, did you do this? Sometimes I will even write down recommended to floss better between tooth number 14, 15. There's a food trap. Oral hygiene, how much plaque was there, bleeding, stain, tartar, things like that. Calculus. What did I complete today? For example, prophy, periodic exam, 4 bite wings, perio-charted, oral cancer screening, and intraoral photos. And the recare, is it a 6 month, 3 months, 4 months? And what are they coming in for the next visit, whether it's restorative or something else, a whitening treatment or a deep scaling. I always write it down there. So that's pretty much my template. Another thing that I'm very big on is patient education. If you notice the layout of my operatory, the computer is like in front of the patient, and I can move it so that I can see it and they can see it. So I have an app that one of my dentists pays for. It's called Spears Education, and I highly recommend for you to have it. I'm telling you, like, it is amazing. Spears login, and it looks like this. And over here we have the patient education tab. These are all my videos. So for example, if we want to talk about a deep scaling,
it involves your hygienist cleaning the teeth above the gum line. Removing excessive calculus and bacteria deposits deep within surface areas of the teeth will be smoothed out to discourage additional bacteria from attaching.
Videos and pictures speak louder than any words I could say. So a lot of the times what I'll do is I'll go and explain to them, I think you may need a deep scaling after we measure the gums. You have a lot of bone loss, a lot of inflammation, a lot of tartar underneath the gums. Let me just tell you what a deep cleaning is. So I explain it to them first very fast, and then I give them, I said, I'm gonna have you just watch this video. That way they understand what a difference between a deep cleaning and a cleaning is. And I find that most of the time, I would say like 95% of the time, the patients will agree to the treatment. Versus if before, I feel like most patients be like, they probably think it's just a cleaning and they wouldn't do it. So patient education, I think pictures, showing videos, it's like the way to go. And sometimes I take a little break while they're watching a 1 to 2 minute video. I will go and do instruments or get their goodie bag or take a sip of water. You know what time it is. Time to go home and start my weekend. He's just got out of work. Want to say hi to the vlog?
Oh wait.
She looked crazy. Family, I made it to the house. Gotta do some cooking. Y esa es sopa de res catracha.
Esa es ropa de rescatar.
Eso.
Eso, catracha.
¿Y el suegrito?
Mucho amor, con
¿Qué
mucho
está
amor.
tomando? ¿Café?
Café.
Eso.
Exactly.
Give me a kiss. Give a kiss to the vlog.
No.
The girls want a kiss.
There you go, that's the kiss.
It was a pleasure having you guys come with me to a day in the life of a dental hygienist. Don't forget to like and subscribe this video, okay? And show it to other hygienists. Kisses. Bye-bye.